Assaults against staff, no backup help to take breaks, and stagnant wages. These are just some of the issues nurses say they're fighting to change in a new labor contract with Seattle Children's Hospital. Today, they held an informational picket to call attention to their concerns. KOMO's Joel Moreno live tonight outside the hospital with the impact of this labor action. Joel?
Yeah, Preston, no patient services were affected by today's labor action. The hospital wants to be very clear about that. But over the course of two rallies, about 1,000 nurses came together to call for a fair contract moving forward. No nonsense for these nurses, who say the vital role they play in patient care is going underappreciated in their contract talks with Seattle Children's Hospital.
We're really just making common sense things that make it very appropriate and easier for us to work here in a safe way.
Nurses who were off the clock staged an informational picket to call for better pay, adequate staffing, and safe working conditions.
Safe staffing is the biggest thing.
More protections against workplace violence is a critical component of the next labor deal, including enhanced security at the psychiatric and behavioral health unit.
We just want them to be responsible for the things they're exposing our nurses to.
Nurses say there aren't enough staff to take breaks without doubling up the patient load for their coworkers.
So it is so important for us, all of our nurses, but especially on our unit, to have break nurses so we can not only take care of ourselves, but to also make sure that our patients are getting the care that they need.
A spokesperson for Seattle Children's says employees are deeply valued and the hospital is committed to being a leader in compensation, adding in a statement, "We are committed to working collaboratively with WSNA in order to reach a fair agreement as soon as possible."
Are they gonna let them take us down? No!
Nurses say the law firm hired to oversee labor talks is committed to degrading the contract.
This is an internationally known anti-union busting attorney.
Yeah, nurses are currently working under a contract extension that goes till November. Today's picket was essentially a way to rally support among union members and call attention to the hospital in case there's any attempts at union busting in the days and weeks to come. Preston and Mary.
Joel, the hospital announced a series of layoffs earlier this month. Is it having any kind of impact on the negotiations?
Yeah, at this point, no, the hospital says that those layoffs are related to reduced state and federal funding, and a lot of the cuts that they're going to be making will not significantly impact patient services. The nurses, though, say the hospital is very profitable. It's got a huge endowment, and they say that the hospital is just choosing not to invest in its workforce.
All right, Joel, thank you.